04. I think everybody received the minutes from Sing by email. You have a hard copy in front of you. Oh, do you want to do introductions? Sorry. Good. Tell me what to do. So we're going to start with introductions. So let's start with those of you that are on the phone. Can you take a moment and tell us who you are and what entity you're with?
I forgot we did that.
Marianne Wren, Advantage Dental.
Paul McGinnis.
Vanessa Pingleton with Douglas ESD of the South Central Early Learning Hub.
Okay.
So we have Paul, Vanessa, and Marianne. Is there anybody else on the phone?
This is Shelly with the Lapine Community Health Center. I'll only be able to join the call for the next 30 minutes. I have a conflicting schedule, so sorry about that.
Okay, thank you, Shelly.
Is that everybody on the phone? Okay. So I'm Susan Campbell with Lake Health Clinic.
Arvinda Singh, Ship Coordinator for Health District, Lake County.
I'm Daphne Greer. I am with two different agencies, the Council on Aging and also the Douglas ESD as a Family Resource Facilitator.
Alana Shamulak with the Eastern Oregon Healthy Living Alliance.
Brooke Kelleher with Food Corps. Christy Albertson, I'm the grant writer for the Health District.
Garrett Shaw with the Lake County Examiner.
Francie Winters, Lake Health District Prevention.
Judy Clark, Public Health Director. Nam Dave, Clinic Director.
Charlie Twig, Hospital CEO, or District CEO.
Okay, so now that Sing reminded me to do introductions, are we ready for the minutes now? Okay. So let everybody review the minutes for a moment if you haven't had a chance to, and then let us know if there's any corrections or a motion to approve.
I'd make a motion to accept the minutes.
I'll second.
Okay. All in favor?
Aye.
All opposed? Motion carries. So it looks like Paul is first on our agenda for the potential lake priority area for community health plan.
Thank you, and I'm sorry that I couldn't be there in person. It was probably a good choice weather-wise for me up here in Central Oregon. I have a couple of different things to share. The first one would simply be that yesterday we got the incentive measure report from MODA on the claims-based measures, and our vendor was able to send it out. It's listed January 2019. It looks as if we are not going to need in Lake County the adolescent welfare visits, childhood immunizations, colorectal screening, developmental screenings, and the rest we did meet. Of course, there's still a few claims out there, and I don't know if Susan's been working with anybody to try to beat things up, but the numbers are fairly small. The numbers to meet targets.
Yeah, Paul, real quickly, so we submitted our Excel portion for colonoscopies and whatnot yesterday. So I have 14 that have been submitted, so I have 14 of that 15 needed. So I've got my fingers crossed that maybe there's a stray claim out there or one of the other health clinics have had one more come through.
This is,
Okay.
is this for the whole county or is this for just, Paul, is this for the whole county?
It's always for the whole county, Charlie. The only reports that are for clinics go to the clinics and are not shared with the CAC.
So Shelly, is there a chance that there might be some Lapine Clinic claims that have not been received on some of these metrics?
As far as I know, all of ours have been sent in, and they're part of the report that you folks are seeing. That's my understanding.
Did they submit any?
We're included in that report. Excuse me.
So we submitted our patients who would be exempt because they had colonoscopies, and that was a manual submission. Do you know if you had any of those?
I do not, I can look into that though.
That would be worthwhile.
Dayla might have some too.
Yeah, and we can check with Dayla to see if she, I imagine she had some colonoscopies probably to send her. Because those are not tabulated by claims.
And Paul, are the immunization status, is that coming from public health or is that coming from the clinics? Because didn't we have a problem last year where
The Oregon, it comes from the Oregon Health Authority's Public Health Division's alert system. Any immunizations, flu shots, those kinds of things are submitted to a central database.
So did they get that problem resolved from a year before where they couldn't validate the information?
They have, as far as I know.
And the two people, we had one in our report, and Susan had checked, we missed that kid, like we gave the kid immunization, but it was after they turned 2. So
Yeah, we missed by like a month. And I did really advocate for us to count, and
yes,
they
we
said,
did.
the Oregon Health Authority said no. No hurt in asking, right?
No, you did a good job.
Okay. Nuts.
Yeah.
Yeah. But hopefully we should get that colorectal to be out there.
But we're not going to get the adolescent bill.
No.
There were 14 more of those. I know I don't have 14 outstandings. I think that that was, a lot of that was not having as good of a turnout at the teen health fair this year.
But we had a really good turnout in Northland.
They had done all of theirs. Yeah. They didn't get very many adolescent welfare visits from the health fair. Most of those kiddos had had their adolescent welfares done at the same time as their sports physicals because they run their program differently.
And so just the fact that they got them still doesn't count in our.
Well, they did. They counted in the number.
Oh, okay.
But it's just that we had 14 more that we didn't see.
Paul, I had a question. This is now, I'm looking at the effective contraceptive use measure, and this is the first time I'm seeing them divided into 2 different age groups. So is that something to expect in 2019, that we will be expected to meet the measure for 15 to 17-year-old and then 18 years and onwards?
They're just tracking it right now, Mom. You're wise to see that it's going to probably come to that.
Okay.
Paul, do you,
But right now it's a collective number, and you have 56.9% rate, so you've met that measure overall. But within those 2 age categories, they're starting to track it.
is there any
And it's
discussion?
the first time.
Oh, sorry.
The first time we've seen it this year is because the 15 to 18-year-old or 17-year-old group was just added this year.
Is there any talk of abstinence being counted as a valid answer for those young people that are 15 to 17 that truly is their form of birth control?
And in fact, we have a religious community that is comfortable with that.
Abstinence is not acceptable.
Right, is there there's no discussion on that now that they have, because last year they lowered the age, that we're now asking down to 15, and so has that been a consideration at all, or are they pretty steadfast on, we're just gonna?
They're pretty steadfast on it, and our clinical advisory panel has written to the Oregon Health Authority saying that at least for that age group, one key question should work for the assessment, that giving somebody a long-term contraceptive could do harm to somebody when they're not sexually active. But there hasn't been a reply. So the clinicians have both had that.
Okay. Yeah, we count on our older population carrying those younger kiddos because we're not, I mean, obviously don't want to encourage that if that's their their choice, but if they're gonna break it out, that's gonna become increasingly difficult to meet.
Yep. But we're still only getting, with money withheld for the entire category, effective
Okay.
contraceptive use, not by age group. And congratulations, folks. I mean, it looks like we're gonna meet the emergency department utilization measure down there for both people with severe and persistent mental illness and overall. And that's been a trouble spot for Lake in the past. Are we ready to move, Susan?
Yes, sorry. I was waiting on you and you were waiting on me. I'll be better next month. Yes.
The document that you should be looking at right now is titled Potential Priority Issue Areas Resulting from Community Health Assessment, Lake County 2019. Does everybody have that?
Yes.
Is the one off the
Great.
minutes?
I'm not going to read the whole thing. The data that was collected and shared at the last meeting, the quantitative data, is summarized under a bigger heading. The bigger headings came from either a focus group discussion or from the past Lake Community Health Improvement Plan. So the big first area that we saw was obesity and chronic disease management. People talked about it at the focus groups, and then there are a number of indicators there, usually where Lake is not better than the state. And also included in the third paragraph of numbers are that we did not meet the measures for controlling hypertension or for controlling diabetes in Lake and in the EOCO. So that big header is dealing with weight, could work in food insecurity, could work in some other things, but it's been part of the plan. The next area was mental health. Focus groups talked about the stigma. The focus group also recognized the efforts that have been made locally to recruit more behavioral health clinicians and mental health professionals. And then we have some data there that comes from the information that we shared before. I think the scariest ones are that the suicidal ideation for 8th and 11th graders is higher than the state as a whole, and the suicide death rate is up there. We did meet the measure for depression screening. The next big major heading is early childhood. It was recognized that there's a lack of adequate childhood facilities in the community. And then there are a number of early childhood indicators, and I'm glad that we have somebody from the Early Learning Hub with us. I think you're going to be talking about a program that I saw that they got funded from the Ford Foundation. But child abuse, kids in foster care are way up higher than the state as a whole. A lot of kids in Lake are at 3 and 4 years old are not enrolled in school. For kindergarten readiness, Lake was better than the state for numbers and operations, letter names and sounds, but lower than the state for interpersonal skills, self-regulation, and approaches to learning. We did not meet the developmental screen incentive measure in 2017. It doesn't look like we're going to meet it in 2018. It is those screens for kids 0 to 36 months that leads to the interventions that our guest is probably going to speak to from Douglas County. It's just a big piece. The other thing that I'd just say about this early intervention one, early childhood one, remember that Greater Oregon Behavioral Health has committed $1.1 million a year over 3 years to focus on early childhood intervention. So if you were to prioritize this area, we know that there may be some resources there.
Paul,
Then within the area of social determinants of health, and this is a big category, including housing, food, and education. The focus group talked about the housing stock is lacking, people living off the grid in North Lake, basic hygiene needs of some of the kids in North Lake. And then our housing data is there. Also remembering that Christie has been bringing information to the local community advisory council regarding the formation of potentially a nonprofit to deal with housing. Housing is also a mandated priority in CCO 2.0, which goes into effect in January of 2020. Food, we have had the summer food program, those kinds of things. We've had Brooke there, but there's numbers there on food insecurity from the assessment, education in terms of overall 5-year high school graduation rates. And then substance abuse is another big heading. You can see from the behavioral risk factor surveillance system what 8th and 11th graders are doing and what adults are doing from the rate data. And then lastly, vulnerable populations were isolated seniors throughout the county. Also had an emphasis in last year's plan for senior health. And it's a large portion of the population by far. Then we have incentive measures. Results are available. If we wanted to focus on any of those that we would pick to put into our plan. What's not on here is oral health, which has been on your plan around childhood health. We've met the incentive measure for dental sealants every year. The reason oral health is not on here, but you should hand write it in case you want to pick it, is that we have no new data since 2012 from the Oregon Smile Survey. Alana has shared some implications that there is going to be a report soon, but without the actual data, it's hard to put it in this report. So I'll turn it over to you, Susan, to try to facilitate a discussion. We definitely need, we can't do it all, obviously. We need to prioritize what we want to focus on over the next several years.
Charlie had something you wanted to talk about under the early childhood? Is that where you were? Or
Yes. Vanessa, maybe you might have some ideas. Are there any communities that are doing well in getting the developmental screening and then addressing the needs of the kids, doing a better job that we could maybe learn from?
Well, so the South Central Early Learning Hub, first of all, covers Douglas, Plymouth, and Lake counties. And there are agencies, but that is something that we actually are really focused on, is how do we collaborate better with getting those developmental screenings done and the use of them. So we know that home visitors and early childhood programs do those. That's a part of their regular requirement to do developmental screenings. And some of the things we would really like to do in the future is focus on how can we get those to medical providers and then them use those, because they are out there. So one of the issues that was actually brought up is that, unfortunately, we're finding with Community Uplift, which is a coordinated referral system, there's not a lot of resources in Lake County for early childhood programs. So you guys have Head Start, and you have your public health nursing, and you have early intervention and early childhood special education. So really just trying to that focus in the early learning world is that you guys are really kind of like a desert. I mean, Oregon is all a desert, but you guys are really very high priority in finding those early childhood programs that can benefit your community. So I would love to have further discussion about it.
Thank you.
Charlie, in answer to your question, Lake by far had the lowest of those that did not meet the measure at 39.4. There were only 3 other counties that didn't meet it, and they were at 54.3, 46.2, and 53. The issue that Vanessa was talking about those, I believe that kids are really getting the developmental screens, whether it's in the home, at public health. You know, the problem is that it needs to get to a clinician to be submitted as a claim and reviewed with the parent. Count.
I think that,
Exactly. I believe that very strongly. And if we can find a better way to partner and get those to those medical providers, and have them review with the family, I think it would be excellent. I would love to sit down and discuss that further.
Okay, thank you. We'll get with Judy and talk about how we can do that. Because we've got to do something to improve. It's not that we're not doing it, we just have to get better reporting.
right. I think part of it is the forms that were being used. It wasn't that the developmental screenings weren't being done, but the specific tools weren't being used, or like getting them to the provider within a certain amount of time. Those are the things that where we were missing. So I think also, you know, being able to partner with maybe Head Start or other places that are doing those same assessments to close the loop and get the claim dropped.
Jill said she was trying to call to Kathy's coming, and she was trying to get some people in, and just was meeting tons of resistance because the families were saying they already saw the doctor for that. And the cases, it sounds as though they're not, but they're saying that they think that they have had them done. So we were talking about strategies of how we will call the physician's office before we call them, ask if they've been in, so that when we call them, we can say, we've talked to your physician and they said, no, this hasn't been done.
That's a great idea.
Because I couldn't, I just, she was hitting a wall and that's all I could come up with doing. And so we're figuring it out. We'll get a plan going and see what we can do about those, because it's very frustrating.
Yeah.
Something you guys might be interested in is the early learning hub in Clemens County. One of their priorities that they're working on this year is they're calling it attendance for life, but they're really focused on those little guys getting into their well baby checks and well child checks. And they partnered with the CCO to go in and actually give incentives. And so, like, families receive books when they go and they attend their well baby visits. But then they went in and actually hired someone who can follow up with those families who did not make their well baby checks. Either they were canceled or they were a no-show. And so the person from the CCO is actually contacting those families and finding out what the barriers were to getting that done. So we can also share that information with you if you guys were interested in something like that.
Certainly, please send it to us.
Do we get stuff from Vicki Taylor from her well baby checks? I mean, some kind of well baby.
It doesn't qualify, it's not.
So
It doesn't qualify.
You guys, and I actually failed to say that you guys forgot that you guys are helping families also. Unfortunately, you only have one home visitor that is, going out and doing those home visits. But yeah, she could. And what I can do is I can get a copy of what that plan looks like, and I can actually email it to you guys, so you can take a look. And then also, we talked earlier about me planning to attend this meeting on a regular basis. So then I can let you know what we are doing in other counties and how we're partnering.
Great.
So, because we're doing a lot of stuff in the counties, in other counties, and I think that we really should be more involved maybe in this meeting, because I think that we can assist or help or work together, because we have the same shared metrics and goals.
I have a
for early
question.
childhood.
And maybe there's one of the other counties that are doing this successfully. Are they meeting any resistance with doing it in that two-part model, where they're maybe doing it at public health or somewhere else, and then getting the families to understand why they have to come in and see the doctor when they've already done the assessment? Has that been a barrier for anybody?
Well, they're just starting in on this, and I don't know if they have any really good data on that. But I just actually came back, when we were talking about this, coming back from Washington, D.C., where we did an ALTA prevention conference. and hearing how people are partnering. And one of the client at the presentations I went to was really focused on educating those parents on why it's so important to get your child in there and finding out what those barriers are. And some of them actually had home visitors that were going and assisting the family at a low baby check. So they were meeting with the providers, talking about what those goals are, and helping explain to the parents about the importance of those well baby checks, and then helping them meet those goals. So if there was a deficit, they were all focused on it as a team. So kind of a wraparound approach. It was a very interesting model that I'm very interested in looking into further.
Okay, thank you. Okay. Paul, do we have more things to discuss under you?
Well, I think people need to share their opinions about what the top 2 or 3 areas are. We're gonna have to start planning very soon.
Well, I'm prevention.
That's all.
And I said, Christy, can I come on the phone today and just be there? She's like, we're gonna decide. And I'm like, no, I need to be there. I gotta tell you this, we just finished the Problem Gambling Community Awareness Survey, and at the end, we did 6 questions that were not on problem gambling that we created at the UCAN Coalition, and they had to do with, alcohol and tobacco and different things. Okay, but it's very clear, we looked at that data today and analyzed, it's very clear that everybody knows that there is an underage drinking problem, and no one really, we do not have either the law enforcement right now or the will in our community to address that. And I really hate the idea that the only way we're going to get that will would be if we actually have a tragic accident. That just burns me. I don't get mad about much, but that one really will get my back up.
Yeah.
And I think that as a community, we talk about, and I believe that we do honestly believe that we see our young people with resources, we listen to them in ways that I have not seen in other communities. I think it's really awesome, but as a social norm of like, well, this is our blind spot, we don't really think there's a low perception of risk within our community, and we need to change that. We really do need to change that, because we look at that. Look at those figures, 59.6. Doesn't that just jump out and get at you? And binge drinking is huge. Now, we can't, preach the negative dare thing that was done so long. We understand that that's not effective. But I was about to run a campaign that says, 61% of our kids, don't use, but this is more recent data. So now I can't run that campaign. I need to change that and run something else, because now I've neutered data. So that alcohol rate is going up, not down. And of course it is, because right now there's no consequence. They think there's no consequence, so they think they're getting a free ride. And the kids have told me they're tired of hearing that they drink all the time and it's their problem, and they like to see the adults be more responsible about it. And I'm like, okay, I'll totally go with that, because somebody's buying it, or they're not locking it up in their fridge, or whatever's going on. And so anyway, that's my vote. I think we really need to look at alcohol. And although tobacco is, and marijuana is on its way up, the other one, Paul, do you know if they're including vaping in the /tobacco area?
Not yet. They have started asking that question, but they haven't started reporting out on it yet, because they need a couple of years worth of the data.
Wow.
I've heard though that's huge in the school. Someone talked to me about that.
I mean, that's a huge thing nationwide, and okay, so that's too bad that we can't do that, but we can't do it in this group. I'll work on it in other ways, we'll work on that, but okay, thank you. Because that's, tobacco is, going down some, the vaping thing is just skyrocketing, rising, and it's really alarming. So that's my 2 cents worth.
There's those really good campaigns that I've seen, the safer doesn't equal safe. Have you seen for vaping? And it's just like kids doing these cartoons. But so if you were to do something under tobacco, would you be, like if there was funding for that, do you think you'd still be able to use it towards vaping as well?
Not out of, that's why I asked him, but I can at the state level. On my state stuff, if I choose to do that will go, I can go both.
So there's gonna be a much larger market for that. I read an article that Marlboro is actually going to stop manufacturing and selling cigarettes.
And go just to vaping?
They're going 100% vaping. And I've noticed a very large increase, and as I've just been like watching TV or whatever, I'm starting to notice, and I would say probably every third commercial is about, well, smoking was so terrible and it's not socially acceptable anymore, and I never thought I could switch to vaping, and like it's totally an okay thing, an acceptable substitute. So I think that we're going to see much bigger presence in that area because of that's just what the industry is going to force that.
There was just a new article on, the butter flavor that's in your microwave popcorn and all the health risks of that, and now that same stuff is in the vaping, and it's real popular, and they do go through what it does to your lungs and stuff. It just drives you crazy. But, it's legal.
So I just wanted to inform the council that after the document for the priorities, there is a document that lists what priorities we need to choose.
So besides the substance abuse, I was really taken aback by the suicide and mental illness figures. I think that's something to look up to. And obviously I'm always pro looking into nutrition and stuff like that, but there are just so many links. Like I was looking at the diabetes, high cholesterol, high blood pressure figures at the beginning. And those are also connected to mental health as well.
Yeah.
So until you have your mental health, addressing a lot of the other social determinant of health things that are on here, you really can't take care of those. So
it's difficult.
I think that oral health is also going to be important for us to focus on with the availability and accessibility to dental providers in our area. We are seeing more ED visits that are based on oral health issues, and I think we might see a similar trend if we look at our walk-in clinic visits as well. So that is something I think we should be thinking of as well.
I don't want to choose two.
You don't? You have to choose two?
There's only two.
Yeah, because obesity is just the root of so much. It really is.
I'm surprised how high our rate for death from diabetes is. We're twice the state.
So maybe while you're looking at that, you could also be thinking about, so what population would we be able to target, and do we have access to them, and what kinds of activities do we have the capacity to actually put forth that we think would make a difference? Rather than just like, we like this one, let's pick that one,
Well, we're gonna have to figure that out because it's metric driven.
Yep.
We may have gotten away this year by just identifying it, but I think it's coming down that it's gonna be much more watched.
I think I was looking at the 2019 CCO incentive measures, and one of them was based on the dental cavities or oral health, which was much more focused than it has been in the past. Paul, have you heard anything about the new 2019 incentive measures yet?
Not yet.
Okay.
They're not anticipating too much change though. That was Tom, right?
Yes.
Yeah, they're not anticipating too much change because this is the last year of the contracts that CCOs have as we put together 2.0.
Okay.
To me, early childhood.
But you're right, I mean, all the only incentive measure oral health is dental sealants. It doesn't talk about whether kids have cavities, how much treatment they're getting, whether or not there's enough dentists in the area.
Well, for 2019, there is another oral health for it with diabetes. Is that what we're referencing, is the 2019 metrics?
Yes.
Oh, I'm sorry, Mary Ann, I didn't know there was one with diabetics and oral health. Is it a claims-based measure or a chart measure?
It is a claims-based measure, and it's for any member who has a diagnosis of diabetes, and that they need to come in and have one of 3 exam codes by a dental provider, and it's either a periodontal exam, a periodic exam, or a comprehensive exam. Currently, what we're doing is having the ECOs give us the information on the diagnosis for patients that have diabetes, and our case management team are reaching out to them to get them established with an appointment. And so that's how we're managing it, but if there's other opportunities and ways that we can work with primary care, we would love to do so.
Well, one of the biggest things that we felt happened with the diabetes measure was the difficulty is that within the 6-week program, they're measuring their blood glucose, but they're not measuring their A1C because that's a longer term measure. And so unless they're going in before they go for this, and then they're going in after it, within those 90 days or whatever it is, we're not getting that data as much as we would like to.
We have built into part of one of our grants, right, didn't we talk about doing this, that we're gonna, to partner with their PCPs to do the A1C as the class is starting, and then to partner and do it again after it's been the appropriate amount of time.
But we did not apply through EOCO. We do not have diabetes, hypertension money coming.
So I think with some coordination, we could maybe accommodate that better.
Yeah, we're going to be running on what we've already established in the future for that, just for our own ability to improve.
For sustainability.
Yeah.
We do have 2, I can't remember the group, the Population Health Management Research Program at OIT and a group out of OHSU. They are studying some of these things around diabetes and hypertension, and they're looking at the Living Well program. Nobody has heard anything. A while back, the Living Well Coalition based out of Klamath Falls applied for a grant that would look at a better program, a better fit for rural Oregon, where you don't have to show up at certain times. They have to take the distance and the travel time into consideration. We don't know whether that grant has been successful or not, but this research is going on anyway, so there will be opportunities, I think, moving forward, regardless of whether we have funding. There's going to be opportunities to partner with some of our Klamath Lake organizations to address the diabetes, hypertension side of things.
We've talked a little bit as well about putting together one of the New Ideas grants for some remote monitoring things that would aid in those 2 areas as well, with the hypertension, diabetes, obesity, all of those things with some remote monitoring possibilities.
Off of that, I was just on the phone with some people in Klamath Falls who do the SNAP Ed program over there, and they've been interested in coming over here. So I'm always talking back and forth and getting resources from them. But they offered to, if we ever wanted to host an event, and they could have 4 or 5 of their nutrition educators over here to help run booths. So I don't know if that would tie in. Yeah.
That would be awesome.
Yeah. So kind of just getting an idea of what we would want. If that's awesome.
Maybe like a workshop that we could do at Daily Days or something like that.
Yeah. Or do you think that would take, because Daily Days there's already so much going on, it might be nice to do
sometimes
something.
we ran different things during that, like I know when Dr. Mary was here, she did a presentation, and we've done a few things like that.
What about at some of the events out at the fairgrounds? Or maybe during a swim meet, where we got a lot of kids, maybe from out of the area, but.
Right. I target a lot of kids already, so I think it'd be really nice to be able to get the adults.
Oh.
I think that's what we're missing with
because they
I
cook,
talk to the
and
kids all
they
the
buy the
time.
groceries.
Well, the kids come home because they saw Miss Brooke, and then they tell you all about whether it is a fruit or a vegetable, and they have too much salt, and that's right. We did a blind taste test, and we get to see Miss Brooke this week, so you're doing a fine job.
And you're like, oh gosh, Brooke's in the school, yeah. But you're a parent that is willing to listen to that and has that openness with your child is gonna do that. Not all children have that. Some children are like, no, you're gonna eat what I tell you because I put it on your plate. No, I mean, that, and changing food habits is huge. It is one of the hardest things to do because it's so based on the family, the internal family culture, as well as a wider culture. And it's about comfort, and it's about tradition, and it's really, really hard to change food habits. And yet it's gonna be so important because it comes, food, exercise, inflammation, obesity.
And the cost of healthy food.
Yeah.
So maybe, I don't know so much about food insecurity as much as the availability to healthier foods.
And here's the other piece, and we've talked about this before, but we haven't gotten to doing anything about it yet, and that is, you get a box of food, but if you don't know how to cook, then it's nothing to you. And I hear people like, Vicki Taylor and people that go into houses, maybe that's Jill, I don't know, a couple of people have said, I go into houses, they've got food, but they're like, I can't cook that because they know how to do Totino's pizza, and they know how to do ramen, and that's it. And that's all empty calorie, not good food. So, we have to help them find out how to cook better and, and what to do with them. Give them recipes, but then they also have to be motivated to actually feel like they can do a recipe and they can follow it, and it's going to be worthwhile and it's worth the time. Someone else was talking about the difficulty of dealing with parents who were not working, but who didn't feel like they had enough time because their whole day was gaming. And so they didn't cook, their child's, eat, like high chair, whatever was in the bedroom where the TV was, everything was all about gaming and watching TV. And they're like, oh no, I don't have time for that, I don't have time for that. Well, how do we change that? How do we, as a society, find a way to motivate those folks to...
Well, that's not something we can address today, but there's a good issue. We should be thinking about locations and times or ways. Maybe we can partner with organizations, whether it's at the school for classes in how to cook, or maybe at Safeway, some space where we got to be thinking about those kinds of things.
I do work with the Take Root Parenting, and they were talking about holding nutrition workshops and things like that.
Where is it?
Where?
It's through the Early Learning Hub for Douglas County.
I have other things on the agenda.
I'll connect with
But
you
we're
about
kind of drifting into problem solving here, and that comes after we pick the priority areas that we want. I don't know how you want to do it, but there needs to be a process in place where people can voice which ones they'd like, and maybe you could do it via an email or vendor or whatever, but next time we meet, we need to have, 4 or 5 of these priority areas.
Sorry, you said 4 or 5, Paul?
Yeah.
Okay, so.
Yeah, I mean, well, it doesn't have to be 4 or 5, but, that's usually what it was before.
Okay.
So Paul, I can set up a survey monkey and send out the link to the council, and depending on whatever gets the maximum votes, we can choose that as a priority area. Does that sound fine to you?
That does. Just make sure that the Word document that I sent to you, that this document that says potential priority areas should go out to that email distribution list.
Okay, I'll do that.
And it should also have oral health at the end.
And when do you need the results back to you?
Back to me, you mean?
Right, when do we need to have a decision? Or
Oh, I think at the next meeting, we need to start thinking about how we're gonna form groups around each one of them to drill down on just the kind of discussion that was happening, right before I intervened.
Perfect.
So, and Paul, just to clarify too, so we have the documents that you sent that has Lake County specific, is that what we're working off of? Because there's also a document that asks for, choosing priority areas for the CCO for OHA, and those don't necessarily match Lake County.
That needs to be in the regional community health improvement plan. I was just gonna ask you guys to give our vendor and Susan, and maybe Mr. Williams if he's there, I couldn't hear all the introductions. You know, at the CAC meeting on, or our CAC meeting on the 26th, we need to pick two of these things to be in our regional plan. So it's just looking for you to point Susan and our vendor in the right direction.
Thank you. Okay, Paul, do you have anything else for us?
No, thank you. I appreciate your time and interest. And again, I apologize for not being here.
Okay. So next we have the EOLA update. I think that we have Alana down there.
Yep, so I'm gonna start with our hiking program. I have our flyer to hand out to you guys. We settled on the name Healthy Happy Hiking, similar to Healthy Happy Smiles, easy to remember. We decided to not go with the Hike It Baby program. We looked into them a little bit more and it's just too paperwork heavy. We'd be too bound to what Hike It Baby wants us to do. So we're gonna kind of create our own program, but we are aiming to, and Paul, actually I have a question for you on this because the numbers that we're using are different than the obesity number you had listed. The number we're using for the EOCO Medicaid members is 40.8, but you have 69.3. And John tells me that it's coming from the same source, so I don't know what the difference is there. Do you have any idea why that is?
Oh, well, this one was from 2014.
No, I don't.
I bet it's
one
not.
for all of the OCC, was one for all of the OCCO, was one just for Lake County?
The 40.8 that we're using is all of the EOCCO. And it's the same data source, the BRFSS 2014. So I'm going to look into that and figure out what the difference there is. But the number that we're using is 40.8.
Okay, the 2014 birth data that we shared in the assessment was just a sampling of Medicaid members. If you go and look at birth data for Lake County, that's everybody.
Okay.
Not just
But the number that John gave me says Medicaid. So I don't know. I'll look into that. I'll figure it out. The number might be different the next time I have a handout for you guys. Who knows? But anyway, so what we are doing is we're going to introduce this hiking program, and our goal is to just prevent that number from increasing. So we want to kind of hold the line there through this program. We're going to hold weekly hikes starting in May or as soon as weather permits. Hopefully May will be nice enough to go out and do weekly hikes. But our goal is to have 5 to 7 families participate in every hike in Lakeview. And then we're also doing the program in Hermiston, but I'm only going to be involved in the Lakeview one. So the goal really is to just get families, particularly we're kind of targeting stay-at-home moms with kids under the age of 5. They're our target population, however, obviously everyone is welcome to participate. We're going to use a physical activity assessment before and after participation in the hike. So we're going to say May to October-ish is going to be our program timeline. Weekly hikes, we're going to do when you join your first hike, we'll give you an assessment, and then at the end of the program, we'll give you that assessment again. Hopefully, we're gonna see those self-reported levels of activity go up 15 to 20%, and we're using the RAPA assessment, which is the Rapid Assessment of Physical Activity. It's out of the University of Washington. Great science research-based survey that we're gonna use. So we are still very much in the developing stages of this because we decided not to do Hike It Baby. We're having to create all of our own liability forms and all of that kind of thing. We are doing an Outback Strong partnership. So this will be under that Outback Strong umbrella. I'm gonna probably call on Brooke because we are hopefully gonna be able to do quick little lessons. I mean like 2-3 minute at every hike, healthy food, sunscreen, stretching, drinking water, that sort of a thing. So you're the expert there, so.
And some of the partners from iTry actually might be helpful for that too.
Yeah.
Like we got some physical therapists to help us out, so.
Perfect.
Be able to talk to you guys about stretching.
Yeah, so hopefully we'll be able to get someone at every hike to give some information like that. I do need to reach out to Mile High Striders, and I think is it Melinda that's in charge of that, Howard?
She's very active, she'd be a good one to go through.
Yeah, and either just let her know what we're doing, if they want to be involved in any way, shape, or form. That'd be great to join forces there and get as many people involved as we can. So as we continue to develop the program, I'll obviously have more information for you guys. I am going to develop a hiking brochure for Lakeview, and it's going to include all of the trails and or the Seroptimus Park, anything in town that we're going to be using for the hikes so that people know where they can go and all that.
I gave Jamie Davis a heads up about this too, and she's part of the.
Talked to her at the gym the other night.
Good.
So yeah. Yep.
May I make a suggestion on your brochure?
For sure. Yep.
And that is, I removed the part about Medicaid.
Okay.
And the reason for it is, we don't, unfortunately, oftentimes in healthcare, we think about how people pay for their services or what insurance company does. The general public doesn't think about that.
Oh yeah.
And we want to make sure that people don't think that we target certain people based on how their claims or their health insurance is paid for.
And this flyer is really just for like community, like partners like this. When I do have flyers about when hikes are going to be held and the brochure, it's not going to have any of that clunky health language in it that people, but yeah, absolutely. That the brochure won't say anything about Medicaid or target population or anything like that. This is just for us so that everyone in this room knows what we're doing.
Do you know where the children under the age of 5, where that came from?
That, I don't know exactly. I would have to ask John why that's our target population.
Planning on hiking with kids that young?
Yeah,
That's
that,
what
well,
I'm
and
thinking.
that's
So it matches age of
and
his
that's
kids.
the language that's in all of the grant proposals that we used.
So is it like expecting them to have, like, carry their kids?
Well, and there are funds available, so like if we do have new moms or families with small children and they say want to participate but they don't have an infant carrier or they don't have a stroller or something like that, we can potentially help provide some funds or find those for them. But yeah, that's all part of the Hike It Baby, that's how they do it, so.
If they go through the prenatal stroller program at the hospital, they can get a Bob stroller through that.
Yeah.
Those are terrible.
Yes, yeah.
Yeah, I don't know how well a stroller's gonna work on our paths. I mean, it doesn't add up very well.
We call it hiking, most of it's probably gonna be like in town.
Yeah.
So we're not like gonna trek up the canyon with toddlers.
Okay.
Maybe, but maybe once a month we'll have a real hike like that.
It would be cool if you guys were able to get funding for those like sort of carriers and then after the program's over, like donating them to even like the bike shop for people to rent out and future.
Not really.
Because you can only have it for so long because then your kid gets older. But I encourage people to continue to do it.
Yeah. Are there any
Great idea.
questions on our healthy, happy hiking? No? Okay, so then I'm going to switch over to mental health first aid. You can leave the lights on. It's all white background, so everyone should be able to see, and I'm totally not going to stand up for this either. I just have a quick presentation. We created our final report for our mental health first aid project that we just completed. So I just have some information for you guys. So the need for mental health first aid is Oregon, we have the highest prevalence of mental illness among youth and adults in the nation. And then very high rates of individuals in Eastern Oregon self-report that they are depressed or have other mental health symptoms. However, they fail to seek the appropriate care. You can click. I'm pretty much reading slide to slide here. The youth need, so this information was found out by Oregon Student Voice, which is a student-led organization based in Portland. They did a statewide survey of 42 high schools and found that 40% of students think mental health resources are the most important issue facing their school. 33% of students were not aware that their school offered any sort of mental health resources at all. And of the students that were aware of resources, only half believe they're easily accessible. What is mental health first aid? So it's a course, it's an 8-hour course that trains participants to identify, understand, respond to individuals who might be experiencing or developing a mental illness or a substance use disorder, and it just teaches the skills, how to reach out, what to say, how to maybe make a referral and help that person, and hopefully connect them to the appropriate care.
So I had a question, Alana. So the training for the youth mental health, but the training is not only aimed for youth, it's for adults.
So the youth training is for adults that work with youth.
Okay.
The National Council is working on creating a youth module. However, it's taking a long time because they want to make sure they get it right, and they want to make sure that it's going to be developed to the point that it's safe to go out and teach to youth and appropriate.
So what are the modules then? There's the youth one for adults. What else is there?
There's the youth module, which is adults that work with youth. There's the standard adult course, and then there are modules of the adult course. There's a public safety module, an older adult module. There's now a fire EMS module. And why am I? There's more. I can't remember. I'm blanking, Christy.
That's okay.
I'm sure at some point in my slides you'll see it.
Okay. Sorry.
No, that's okay. So the goals of our program were to just improve the skill set of residents and public employees of the EOCO region, to recognize those issues, and then hopefully improve connection to care for individuals that might be suffering. Our target audience was public educators, law enforcement, individuals that work with older adults, and then other public and social service employees like Forest Service, that sort of thing. We wanted to train between 450 and 600 individuals. We wanted 95% of them to become certified, and we wanted 90% of them to indicate through self-reporting that they felt their confidence in their ability to identify and to make referrals and to use all the skills was increased. And then we also wanted 20% of individuals to self-report making a referral. So our outcome, we provided 30 trainings in 11 counties. So we hit our goal of the number of trainings we wanted to provide. 7 of which were adults, 7 were public safety, 13 were youth, and 3 were older adults. We met our goal of participants, so we had 453 participants and 99% of them became certified. And we fell short of our increased confidence level goal by just a little bit. We had 81% of participants self-report that increased confidence level.
Another quick question. Did you conduct any older adult trainings in Lakeview? You did?
We did.
That was the one at the senior center?
Yes.
Okay.
Good enough.
So this is just the number of trainings we held per county. I got Lake highlighted there. We actually held more trainings in Lake County than anywhere else. And the project year, the time was 15 months, so it was September 2017 through December 2018. We held all of these trainings. So that's just that breakdown there. And then this is the number of individuals certified per county, and then breaking down also by what type of class it was. So specific to Lake County outcome, we had those 5 trainings. So 2 were youth, about a year apart. 2 were public safety last January, and then we had that 1 older adult in February. We had 65 individuals trained. And then we are sending out a 6-month post-training survey as well as a 1-year post-training survey. Almost all of the 6-month surveys have been sent out at this point. I've got a few more in the next few months. But at that 6-month mark for Lake County, we had 16 referrals made with 5 known connections to care. So that's either to a school counselor, therapy, clergy, whatever it might be, whatever that person considered appropriate care. And then of the 1-year surveys I've gotten back, 3 additional referrals have been made since that 6-month mark. Overall, for the whole region, for our 6-month post-training surveys, I've sent those out to 334 people so far, and we have about a 21% response rate. And 93% of my respondents say that they feel the skills they learned has been helpful in their personal or professional life. And right now, at that 6-month mark, we're at 7% of individuals have reported making a referral to care, and our goal there was 20. Obviously, that number is going to continue to change as I continue to get survey responses back. But overall, I've had 51 total referrals to care made with 25 known connections to care. And then at the very bottom there, it's just broken down that 27 were by a participant of a public safety module, 17 by a youth participant, and 7 by an adult. So I really love that public safety number. That shows me that our law enforcement are really taking this stuff seriously when they're attending the classes and they're actually using the skills. So moving forward, we do have some carryover funds, and we are actively looking for more funding. So we are going to continue to provide the adults and the youth courses and all of the modules in this new calendar year, with a goal of providing 1 training per EOCO county. And next slide, we have a training next Saturday, the 23rd. It's a youth training at the ESD. So spread the word. Let people know, attend it if you're available. I know it's the same day as the Expo and Snowfest, but if you're able to attend it, please do. We have, I think, 4 people signed up right now. So we would like, I'd like at least 15 people. So spread the word there. And there's a copy of the flyer in your packet as well. And then my next slide is just that our full report. I don't think it's up on the website quite yet, but hopefully by the end of the week it'll be up. And I will be sending out our media release tomorrow.
Do something for that level of action.
Perfect. Any questions there?
I took a youth mental health first aid back in Michigan, and I worked with at-risk youth, and I found it really beneficial. So.
It's an awesome training. Yeah, I love it, and I actually prefer to teach the youth course over the adult course. So I'm excited to get to teach one again.
2 from public health, so we're 2 out of the 4.
Good. Do you think it'd be better if it was on a Saturday, or does that make a difference?
That was the day that Leanne chose because she wanted her youth mentors to be able to attend it. So.
Thank you, Alana. And so, saying I think we have updates next.
Thank you, Susan. So the first update I have is about the teen health fair prizes. we have given out the Lakeview prizes. I haven't been able to travel to Christmas Valley due to weather conditions. Hopefully sometime next week. If it doesn't snow too much, we'll give out the prizes at North Lake. Second update is about the Living Well classes. So the Living Well with Diabetes, we began the classes on January 16th. We are left with 2 more classes to complete the 6-week session. We also began the Living Well with Chronic Conditions this week, but nobody showed up, probably because of the heavy snow we had gotten. Next update is about the point in time count to capture the homeless population in Lake County, Lakeview. So the Lakeview point in time count was conducted on January 31st at the gathering place. I would say the event was successful.
Class was really thrilled. I don't know that the gal who was in charge of it had ever been part of it in Lake County before, but she was really pleased with the turnout and with the volunteers who showed up. So those of you who were there, thank you very much.
Yeah, we had a good turnout.
What was our number?
We don't know yet.
We don't know yet.
I can give you a rough estimate, but obviously we don't have the official numbers yet. The most recent homeless count was 12. So on that day, we got 40 surveys. That was around 40 surveys that was submitted to the point in time count staff. And also one survey does not necessarily mean that it represents one homeless person, because at times there can be multiple persons depending on the household, but they do submit just one survey. So I'm expecting it should be more than 40.
Well, and not all of the people who filled out the survey were homeless. I filled one out for a gentleman who wanted to be involved, but he has a house, lives with his mom, and that is not in any danger of changing. So
Okay.
not all of the surveys we collected were for homeless people.
That doesn't count. More than 12.
More than 12.
More than 12.
Yeah.
Probably.
Pretty much.
Do we know how North Lake went?
No, not yet.
Not yet.
No.
Karen Rippey is the name of the gal from class, and she was hopeful that maybe by the end of this week we'd have numbers, but we don't know yet.
And during the event, we also handed out Safeway gift cards, blankets, sweaters, and socks with the help of Klamath and Lake County Action Services and the Obesity and Renewables. So a big thank you to them.
I have a question.
Yeah.
All this info about, what was it, the priority issues areas, where it says the 12 unsheltered people, under that it says 1 in 28 students, 44 children experienced homelessness in 2016 to 2017. So why isn't that part of that 12 count?
It's so point in time is where did you sleep last night?
Okay.
And that, it said unsheltered, so it was the people who were out in the elements, it's not counting couch surfers, it's not counting, whereas that other number you gave.
And also we need more clarity with the homeless count. During the last early learning hub meeting, so Mr. Jack Thompson said that the school district have their own homeless children numbers. So I'm definitely going to meet up with him and discuss. We don't want to duplicate the numbers, but at the same time, yeah, we don't know what the system is.
They're looking at two different things. The school's looking at over the year, this is how many kiddos were homeless, and point in time is last night, where were you?
So we
The
can't.
school uses McKinney-Vento. Yeah, school uses McKinney-Vento, and we were using the time, so they're different.
Yeah, they're totally different.
Okay.
Apples and oranges.
So the next update is about the dentist.
Arthur,
Yes, Paul?
this is Paul. I just wanted to share that I'm appreciative that people went out and did that point-in-time homeless count. We definitely need more to do it. At Harney, on Tuesday, they reported that they had over 70, when prior to that, it was about 2 and 18 in the data.
Okay. Yeah, that's the same case in Lakeview.
You've had a big increase too.
Thank you, Paul.
Do you think, Paul, that is because of accuracy counting or because the need has changed?
Accuracy of counting or what has changed?
Or conditions within the county have changed, causing more people to be homeless?
Oh, I think people weren't counting at all before, Charlie. We got way too many zeros in our region.
Yeah.
And, you know, the better the count, the more, you know, the resources might be able to be available to help.
Next update is about the dental screenings and sealants. So the first round of dental screenings and sealants occurred on January 17th and 18th. The second round is gonna be on February 22nd to finish the remaining screenings in Lakeview. Next update, so there is a flyer for community uplift. Daphne, can you
Oh,
share?
yes. Yeah, Vanessa also is going to speak about that. But
Yeah,
we're
okay.
from the Early Learning Hub, and this is a program that she has spearheaded. So Vanessa, I'll let you take over and elaborate on that.
Okay, so I just want to let everyone know, first of all, I am traveling, so if I break up or if you lose me, I'm sure Daphne can pick up. But if you see that, we gave you guys a brief, just a brief description of community uplift. And what that is it's a coordinated referral that's connecting expecting parents and or families with children 0 to 5 to early childhood programs. So such in your guys' county, it would be early intervention, early childhood special education, your public health nursing, and healthy families. And what it really is it comes down to is a closed loop referral system. So once Daphne receives a referral, which currently is coming through fax, but we are soon to be launching a HIPAA and FERPA compliant data portal where we can receive referrals that way also. She would then contact the family, and I think on that one pager it gives you kind of a brief description. So she would contact the family. She asks them a couple additional questions once she receives, once she gets that information. Then she shares with the family what childhood programs that they would qualify. And then with the family, go over what those programs are and help the family choose what programs they might want to go to. One of the problems in Lake County is there's not a lot of early childhood programs. So you have Head Start, which I believe has 20 slots. And then you have EI and early childhood special education, which they accept everybody. They have to, if they receive a referral, they have to do an eval on every child that they receive a referral on. It doesn't mean every child qualifies for services, but they do have to do an evaluation on those children they receive referrals for. Healthy families, they serve children, so they serve expecting moms, or they can have a child in their program come new into their program before they're 3 months old. If they're 3 months and older, they cannot enter into healthy families. And then they can keep them to the age of 3. And then, of course, you guys have your public health nursing, which I'm sure you guys are well aware of those programs. But they see expecting moms, so they have maternity nurse case management, and they have Babies First, and then they have the Cocoon program, which serves children with disabilities up to the age of 21. And so in your guys' county, Daphne is your guys' family resource facilitator. She's a new to that position, so she is just now starting to really get the word out in Lake County about what community uplift is. And then back in 2017, we did a soft rollout, and we worked with your, in Christmas Valley with the medical clinic up there, and also with your guys' It's Risen Birth program. So when families were in like kind of that mandated home visiting, and their time was up with them, if they wanted, they could go to a voluntary home visiting. And so we received 6 referrals, and I believe out of those 6, 5 were connected with services. And out of those 5, 2 of the families were already in services. They wanted some additional information. And so they were connected with their home visitor and they got that information that they needed. So I'm wondering if you guys have any questions that I can answer.
I don't think we have any questions at the moment. Yeah, probably no questions at the moment, Vanessa. Thank you.
Okay, thank you.
Yeah, my final update, if you look at the last page in your packet. So we are going to have a veterans listening session and claims clinic. This is from the Department of Veterans Affairs. This will be held on April 24th from 11 a.m. to 2 p.m. at the Outback Retirement Center in Christmas Valley. And we were informed about this from the Crisis Center. Yeah. Brooke, can you give us quick updates on food court?
Sorry, just to add one thing just about this. John Effingham called into a meeting this morning, the Older Adult Collaborative meeting, to talk a little bit about this. And he did say if you are an organization serving Lake County seniors and I think you should have a booth or something at this event, that they're open to that. So get in touch with John if you're interested in being part of it.
Thank you.
Yeah.
Arvinda, there's a chance I'll try to go to that as the planning director for the county.
Cool.
Okay.
Have we done this kind of, similar kind of program here in Lake County? In Lakeview area?
Well, we did the barbecue thing, the veterans barbecue.
But did we deal with claims? That was in mental health. And that was more suicide prevention. And this is interesting to deal with claims issues. I would encourage us to think about having that same kind of program, because we have vets both in North Lake as well as in South Lake that could all benefit from dealing with claims.
Yeah.
And people that are trying to help them, you know, I mean, like,
Yeah.
there's girls in my office that would be beneficial.
Learn a lot from. So,
I think John said this is a route traveling through Central Oregon, which is probably why Lakeview was left off of their itinerary. So that's why Christmas Valley is the spot for this.
maybe what we can do is talk with Charlie Pike about seeing if we could get something like this held here, because it would be real beneficial, I think. Because those, if Darwin can go, that's great, but if
I'm gonna see if Charlie and I can go together.
Sorry?
Yeah, I'm gonna see if Charlie and I can go together on this.
But it would be great for either billing offices or vets themselves to go.
Or even like Anna was saying, the receptionists, the people that, you know, we often dial the phone and we're there with them because they don't know what questions to ask, and we can't call for them because they won't talk to us, and so it would be nice for them to have some additional education.
Great thing.
Yeah.
I guess, well, the only things really are, we finally were able to order foods for the school lunch menus. We went through the school district and helped them with the grant that we got. So a few different local Oregon companies that we're going through. Cool. And I'm gonna start trying to taste test in the cafeteria with those specific food items. Ellie was a big help today. Made hummus. Darn wanted to try it.
You're not allowed to make that face.
I tried not to.
It wasn't a big hit because the kids saw that it was bright pink, so they're like, oh, it's gonna be like candy, and it was not.
Hummus, chocolate.
They all liked the plain hummus when we made it in class. I was like, eat hummus, yeah. But it wasn't go over very well. So our hope is to get some by March, and we're waiting on some info from the school, so it might be later than March to actually make changes to the lunch menu. So it's not just, you know, we're trying things, like we're seeing actual change in the school menu with those items. And then the other awesome thing that happened was when Christy was talking to some people from the food bank. I was there for that, and I've been struggling trying to do these cooking nights with families, and I just I've been trying to figure out funding for it, and the food bank in Klamath said that they would be able to support that. So, yeah, so.
And where will that take place?
At, which church is it?
The Presbyterian.
Not the Presbyterian,
Methodist Church with a kitchen.
nope, I've watched it,
The Methodist?
Oh, it's Episcopal.
It's a cooking-
It's stepwise.
Episcopal.
It's stepwise. Yeah, stepwise is
Saint,
Episcopal.
what is it called?
Episcopal.
Saint something?
I don't know.
Episcopal.
I think it's easy.
Anyways, yeah, it's the one right
cute
next to the
little
old
blue
Head
one.
Start.
Yeah.
Yeah, okay, so, yep, so they've given me, and there's great kitchen space there. Yeah, so just trying to figure out how I would offer that to families, and trying to get volunteers, so if anybody's interested, I'm gonna try to do 3, one a month. Cool. So March, April, and May, shoot for that.
Can you tell us about how the school, or how it's coming to get the school system to have more free lunches for kids?
Yeah, so we were able to, that was with the CEP program, is probably what you're thinking about. So Northlake, they are definitely qualified for that. Our vendor has been talking to someone from ODE, and we're just still not sure about why the number that the school has. So it's a way that they calculate it. It's called ISP, I don't remember what it stands for, something student percentage. And I really do think that our numbers would be higher if it was better reported. So, yeah.
Yeah, so I'm working with Susan Warner, so she has different numbers from what the state has. So all we need to do is get that data that Susan has and submit, and they will change the numbers, and we need to do that before April 1st.
Is there anything that we can do to assist? Because that can have such a huge impact on the kids in their learning process to be able to have meals. And I mean, it plays into what happens for the summer. I mean, this is a big deal for us.
Right.
Yeah,
We
for
don't
now-
want to let, if there's anything that we can do to support the school in that process.
Something you can,
Yeah.
a way that you can
Well-
support Oregon, because Oregon, actually next Thursday, sorry to interrupt you, next Thursday, Partners for Hunger Free Oregon is going to the state to request one more farm to school dollars. So they're, right now, what food corps is getting supported through and what are the school gardens, all those grants, and farm to school education, they're requesting more money for that, and they're trying to request for our school lunch to be free statewide, which is a big push and probably not gonna happen, but it's a step, so.
So that's what this program would allow, would be free lunch for all of the students regardless of.
Yeah, and that's from federal dollars. So the one that this group's pushing for next week would be statewide.
And you're working with Susan, so, yeah, I'm aware of it. And I know when we first brought it up, Susan was here,
Yes.
and, I know she's aware of it. I'm aware.
Whether or not it impacts on the state level, we're focused on Lake County. And if we can get our kids in our schools to get this because of the counts that we have, that has a great impact on our community.
3% away, that's what the number is that's keeping us from it. So, like, just a few students with such a low population, it's a few students that might not be counted.
Thank you, Brooke. Yeah, that's all that.
That's all I have? Okay, so briefly, we're just about out of time. Christy, do you have some grant updates for us?
Yep, I will. We got all 4 of our EOCO grants applications submitted on time. We'll hear about those the 1st of March-ish. For those of you who were involved in the 2018 EOCO projects, you have all received calendar invites to me, and I used invite intentionally, but please be there and ask me about those meetings. They're all happening next week. Grants that we've been awarded, Lake Health District was approved for $90,700 to implement parent-child interaction therapy at Lake District Family Center, which is the Marius building, assuming it hasn't crumbled under the weight of the water. So that will start, that'll cover the biennium, so those dollars will be available in July. And we, by VA Chip, have been approved to host an AmeriCorps Vista to address some of the nutrition-related issues, so they'll be able to help Brooke with some of the family dinner planning things, different nutrition education initiatives, help with the food bank, food pantry, food share, and farmers market, just to try to make these things more accessible to low-income people and make the community more aware of how these things work. I'm sorry, I'm trying, Susan, to be.
No, you're fine. We started a little late.
The Klamath Lake County's community food assessment, that was one of the conversations that Brooke mentioned, having a conversation with Nikki Sampson, who's the director of the food bank, Klamath Lake Food Bank. In addition to finding out that they can support the community dinners, the cooking nights, we found out that they get random donations of stuff that's available, night lights, and I don't know what else, but she's gonna give me a list of all the things that they have. So if we have a program or a project that needs something random, some kind of handout, then we need to hit them up first to see if maybe they have it and can donate, because again, they're Klamath Lake, and we are trying to encourage them to include lake. The reason that call got set up is because that assessment, even though it was the Klamath Lake Community Food Assessment, there really wasn't anything current out of Lake County, which is frustrating. So it was a really good conversation with the food bank and also with the researcher. She is based out of that population health management research program at OIT. And if there's funding, if we can find funding, she's willing to come over and do an addendum to that report that focuses solely on Lake County, which could be useful in the long run, going after dollars to support food programs. So I'm just gonna throw that out there.
But since the original funding was there, shouldn't that have been covered?
It was Klamath Lake Food Bank who got the funding through Oregon Food Bank,
I
and
know,
it's
but
gone
they
now.
should.
Yeah. No, I know. Nam, you wanna talk real quickly about the ARCOR grant and where we're at with that?
Yes, so we received $200,000 through the HRSA for the opioid grant, and we are in the 4th month of that grant. Our big piece of that grant was doing a community survey, a tri-county community survey. So we are working with Klamath County and with Modoc County. I have been in contact with different agencies to come and join the consortium. We have been successful mostly with getting mental health and public health from both the counties and law enforcement agencies to join the consortium. And we have a vendor from Ohio that is going to be sending a survey out to the community members. The survey is going out next week, and then after that we will be working on creating a strategic plan based on the response that we receive. And the survey is going to 1,200 people in each county. It's a random survey, so we will be doing some news releases to make sure that the community is aware that we have this program going on.
If you get the survey, please fill it out.
Just don't change your name to random.
Part of that too, we're also going to be surveying people who would have a different perspective. So law enforcement, first responders are all going to be getting a survey. Our primary care providers will all be getting a survey, heads up Dale. And our behavioral health providers will all get a survey, so that we'll have kind of that professional input on what everybody is seeing as far as opioids are concerned. The other piece too is Narcan. That was one of the approved expenses, and even though this is a planning grant, we were approved to order Narcan for all the law enforcement officers in the 3 counties who need it. So we have 22 packs in right now for Lake County, so that'll cover all 9 of our current patrol deputies with the sheriff's office, the 4 that our sheriff anticipates hiring to cover Lakeview, 6 probation, parole, all of those guys and gals will get it, and then 1 for the jail as well. So all of Lake County will be covered. Klamath County Sheriff's Office already has it, so I'm working with the City of Klamath Falls to figure out who on the police department needs it. Lisa Cahill has offered to be the trainer, so we have a date in March that looks like it's going to work for everyone. We just need to know how many units and to get that set up. And then I have the contact information for both the county and City of Alturas, so we'll get the Modoc County folks taken care of as well. Upcoming grant opportunities. Francie and I are going to apply for a grant through the Ford Family Foundation's Children, Youth, and Families outlet.
We are invited to We were invited
We
to
were
apply.
invited to apply, so we are gonna ask for 3 years worth of funding to support the Methodologies Theater project that Francie's working on with the North Lake kiddos, so that it can go beyond North Lake School. And then I don't know anything much about this, except Abby sent me an email heads up about this, that the Oregon Office of Rural Health has an EMS improvement opportunity coming out. The RFP hasn't come out yet, but maybe tomorrow, maybe early next week. And this is for hospitals that have received the, is it Medicare rural, the Flex program. We're eligible because we have that Flex program grant. And it can, the projects need to be related to EMS sustainability or to data collection and reporting, both of which would be great for Lake County and what we have here. So those are the two definitely on the radar. There are a few also potentially on the radar. Summer lunch program is coming up again. We are going to apply to be the sponsor for that. We have a planning meeting next Tuesday at 3:30 in the South Conference Room if anyone wants to be part of planning the lunch program. Part of what we need to figure out is whether we want to keep doing the activities like we've had for the last couple of years, if that's really where we should invest time and money. Whether we have at the north end the capacity to launch a site up there as well. We're really hoping that we do, but we need to know pretty much now if North is on board and can do that, because it's going to require petitioning the state and possibly the feds to get the approval to have a site there. So yeah, 3:30 next Tuesday, South Conference Room for that. Those who show up will get a fabulous prize.
Will you be able to allow Shelly from North Lake or from Lapine Clinic to be present, or?
She's gonna call in, or someone will, we hope. So, and we've reached out to the school up there as well and trying to figure out, yeah, and Shelly, so Kathy Pike was the outreach person in the Christmas Valley Clinic and no longer is there, but they have hired a replacement named Peggy. And so hopefully Peggy can be part of the planning as well. We kind of just threw a lot at Peggy all at once. Other stuff, very quickly, there's a new initiative, I'm not sure what to call it, going up on Outback Strong to kind of help further that positive social norming that we're trying to do, called Celebrate Lake County. And the idea is to spotlight an unsung hero, whether it's a group, a person, a place, to go all around Lake County and all the different communities and highlight the people and places that make this place awesome. So the very first one will be up in March. The Paisley school kids are going to do a video about a longtime teacher, and I can't remember which one. And O'Leary, which O'Leary is there? Mary? Mary O'Leary. So yeah, they are very high tech in Paisley apparently and want to do a video. So that's the game plan for that. But if you guys have ideas for all around the county of someone or something that should be highlighted that maybe the old timers, those of us who grew up here, have been here for a long time, know about, but maybe the new people here don't know about, or people who don't show up in the Examiner every other week. You know, help me find those things, because they'll be good to highlight the things that make this place awesome. Villages is another thing for y'all to be aware of. So Klamath and Lake County's Council on Aging has hired a part-time person to coordinate the Villages project in both counties. Villages is a project that aims to help older adults age in place. And this is where we're looking for skilled and unskilled volunteers, people who can help put up grab bars, ramps, help with plumbing crises, and people who can show up and visit with someone once a week or take someone to the grocery store. So you will be hearing a lot more about Villages in the future. The Older Adult Collaborative next month will finalize a logo, and as soon as we have a sweet logo, then we'll move forward with promoting. But we're gonna have stuff at Daily Days. The Elder Abuse Awareness Day, whatever that day is called, is in June. There'll be an event at the Senior Center, so we'll be out in front of the community and spreading the word about that. But if anybody is interested in signing up now, just let me know. I'm helping until we can get that part-time person over here a little more. She's been on the job for 3 days, so she will be over here, but she needs a little bit of time to get organized. The other quick update is about supportive housing. We had a meeting on Tuesday about that to discuss the permanent supportive housing project that we're looking into creating to help those folks who just keep cycling through DHS, probation, parole, mental health, all those individuals. We talked briefly, the Oregon Housing and Community Services released the statewide housing plan this week, and there are 6 different priorities in that plan, one of which is rural and one of which is permanent supportive housing. So there, in theory, will be dollars coming down for a project like this. We had been talking about Housing First as a model, which is where the dollars are at right now, frankly, and it's the model that says, we know you're a hot mess, but you do not have to be in counseling or be doing anything in order to live in this place. I am going to look for the group, try to figure out the numbers, the success rate, and kind of how successful that Housing First model is versus the old model, which is the readiness model, where you do have to be in services and be taking active steps toward your own recovery, your own ability to be a functioning adult. We talked with a guy at DHS over in Klamath, and they have a project in Klamath Falls right now that's more that readiness model. And it's too new for them to have any kind of real data about that, how successful it is, but they chose to go that way. So we'll have more. We're still looking at funding that Obsidian Financial, like Arvinder mentioned, gave us money to do the pit count. They're interested in potentially funding a supportive housing project over here. We don't want to say no, because it's money and it'd be awesome to have some support. The condition with that is that they would need double their money back after 10 years. And so we don't really know how to make that would be a challenge. Not that it's not doable, but it would be a challenge. But then we've been put in touch with some really good contacts around the state who have other ideas and have experience in this kind of housing, who can help us figure out different funding models. And someone, Charlie, I think, mentioned the idea of the 501c3, which I think I brought up here before. That's been suggested as, and actually one of the gals I talked to whose background is in low-income housing was very much in support of turning Outback Strong into a 501c3 and having that be the entity that focuses not just on housing and then continue to be the brand for all of our different projects, but include housing as a social determinant of health as part of what it does. So we'll just keep you all posted. We don't really know what's happening there yet, but we'll keep working. That's it, I think.
Okay, Charlie, anyone else have anything else to share with the group?
Thank you very much, everyone.
When's our next meeting?
March 14th.
Okay, so our next meeting will be in
Thanks,
March.
folks.
Thanks, Paul.
Good meeting. Bye now.
Bye. March 14th, single thing.